Hi, this is Dr. Kurt Wohler for Autism Recovery System. We're going to talk about the food IgG test. So, food intolerances can be broken down into many different categories. So, you can have intolerance to certain chemicals in foods like phenols and salicylates. And then we get into immune reactions to foods. So, the classic food reactions that are linked to allergy are linked to an antibody called IgE. This is what releases histamine. In severe cases, we can get anaphylactic shock. And peanut allergies, shellfish allergies, these are fairly commonly known. But the reality is most food reactions that people are suffering from that are causing chronic health problems are not IgE mediated. But certainly environmental allergies are. So pollens, grasses, animal dander, for example, all can cause allergic reactions, skin rashes, sneezing, hives, etc. The IgG reactions don't typically cause a histamine response. They're not causing an anaphylactic reaction. The symptoms are more delayed versus the IgE. The IgE can come on very suddenly. IgG reactions many times are delayed, sometimes hours and sometimes days later. And so there's a lot of clinical usefulness for IgG related problems in people with chronic health issues, psychiatric illnesses as well, and it certainly plays the special needs community. Great Plains Laboratory has a food IgG test. It's a comprehensive food IgG panel, and now you can get it through a dried blood spot. So a finger prick that can be done at home, a finger prick test that can be done at home. And what it does is it's looking at IgG related to a wide variety of foods. The things that most commonly come back high for kids on the spectrum are things like dairy, so casein, cheese, yogurt, for example, as well as gluten. So in this particular case, we can see here that the gliadin is elevated, so that's linked to gluten consumption. Wheat is also high, and then of course the casein and the yogurt is high as well. It's not uncommon too to see other elevated IgG reactions, sometimes to eggs, sometimes to nuts, sometimes to other types of fruits. So not a lot else we see on this particular test, and the test does break it down between low reactivity, moderate, high reactivity. Now, because IgG is a memory marker, it's an indication of past exposure. If your child hasn't eaten gluten or dairy in quite some time, in some cases could be some kids haven't eaten it in a number of years, you wouldn't expect that when they do an IgG test that the levels would come back high because there's no longer the immune reaction occurring. So the IgG reactions will typically correlate to a lot of gut problems, so it can lead to bloating or gas, sometimes constipation. Adults sometimes get fatigued, joint aches, muscle aches and pains, these types of things. There is a lot of research on IgG reactions linked to other types of immune problems, sometimes autoimmune conditions, and many times neurological and mental health disorders as well. So the IgG test is definitely important to do to get an overall assessment of immune food reactivity or adverse food reactivity. One of the other tests that's done, this is available in another video, is the urinary peptide tests. Peptides are different than, or they react differently than the IgG antibodies that get produced. We can see in this particular test that the peptides to casein in milk and the gliadin in wheat are both elevated. But again, these have a different type of reaction, and not every child who has an elevated peptide will have a corresponding increase in an IgG related to that food. So both tests are useful, but both indicate different types of food reactions. The peptide tests will often manifest as more of a drug-like reaction where kids become addicted to the foods. It can cause comprehension problems, eye contact issues, cause sensory imbalances, etc. So we'll explore that in a separate video. There's a website called Lab Test Plus that is available. It carries a number of different labs from Great Plains Laboratory and other labs too. It includes the food IgG panel. So you can go to labtestplus.com and look at the list of labs that are available. And each lab, when it's ordered through the site, will come also with a individualized written interpretation of findings and then what are called action step suggestions based on those markers. Again, I'm Dr. Kurt Wohler for AutismRecoverySystem.com. Thank you.